I need to know why. Take, for example, when I was 8 years old, my family got its first computer. But instead of typing or playing video games or looking at pictures in the encyclopedia, I had to take it apart. You see, my 8-year-old cortex had absolute confidence in my ability to put it back together, just as long as I got to see how it came apart in the first place. The ending wasn't what I expected. In fact, I learned 2 important things that day. The first is that SATA ribbons cannot be reordered. And the second is that compared to my siblings, I was top dog in the pain in the butt scale. But that's my MO. I need to know how things work. I love to observe the world around me. But what really gets me is how the human body operates. Call it epigenetics, which, for those of you who aren't familiar with the word, is the passage of information from one generation to the next. So take, for example, if you're an elite runner, that overrepresentation in proteins or big lungs or mitochondrial density is passed on to your offspring. If you're an engineer, the part of your brain that is overrepresented in math and science, that capacity is passed on to your child. Now, I was fortunate enough to be born to 2 generations of doctors who focused on treating pain, both acute and chronic. So you could say the apple wasn't going to fall too far from the tree. In a nutshell, in the winter, we had a hot tub, and I was fascinated with jumping from the hot tub back into the snow, back into the hot tub, back into the snow, because I knew I was in a safe space. I wasn't going to burn myself. But I felt this burning sensation when I got back in the water, and I found that just fascinating. So from an early age, I knew I observed pain differently than those around me. You know, everyone has little injuries, but I can remember if I had a headache or a sore back or a migraine, or at least I thought it was at the time, I could ask my dad or my grandfather, and they'd either do a manipulation, a little bit of soft tissue work, maybe give me a supplement, and my symptoms would go away. I was 8 years old. I didn't understand clinically what was happening at the time, but the mechanism was simple. I had a problem, I brought it to someone who I thought could help, and it went away. Now, in addition to being generally destructive towards all things electronic, I was extremely competitive, and it didn't matter. Soccer, basketball, math team, Monopoly, I was all for it. And from time to time, people get hurt, especially if you're playing Monopoly in my family. But it really bothered me how my friends' experiences with injury would differentiate from mine. I can remember James, who had to sit on the sideline with tendinitis, or there was Andy, who had a headache, or there was Kyle, who had this terrible-sounding condition called Osgood-Schlatters disease. They would be sitting on the sideline often for 2 to 3 weeks. Sometimes they would miss an entire season, hoping that doctor's orders of rest, ice, and Advil would make their symptoms go away. Now, the contrast to my experience with my friends was stark. I can remember having bilateral stress fractures in both of my shins, but a little bit of nutritional therapy, some electrostim, some muscle work, I was able to train through it. I didn't miss a single day. Now, my younger brother fractured his femur, which is the largest bone in your body. And he did miss the season for that one, okay? But to repair a femur, it requires the insertion of a surgical rod so that you can reduce the fracture and prevent a deformity. Now, the surgeon advised us that at the time, it would be a minimum of 12 months healing before the rod could come out, because in this procedure, that had to happen. But my brother followed a similar nutritional therapy, and after 6 months, follow-up x-rays demonstrated too much bone growth. His follow-up surgery was unnecessarily painful because they had to chisel the excess away. So seeing that my experience was so different than those around me, I knew I had to go into medicine. I had to understand, what is pain? Why do we perceive it this way? And in the last 10 years, my life has been transformed. To me, there are few things that are greater than taking away someone's burden. To take away something that someone thought they would have to live with the rest of their life. But you know what I've learned? I don't know everything. And I don't think anyone else does either. All too often, a patient will come to my office and say, my doctor said it was in my head, or that there was nothing that could be done, or that it's related to age. And I would assess them or diagnose them, and it would be something that we could quickly heal because I had the right tools. It doesn't matter what your healthcare specialty is. You are limited by that schema of diagnosis. Simply put, if I'm a hammer and you're not a nail, it's not my problem. Medicine, osteopathy, acupuncture, nutrition, on and on and on. We all have our own systems for helping patients. But what happens when that system fails? What happens when we create a secondary problem? The current opioid epidemic is a great example of that. The National Center for Health Statistics states that in 2016, 64,000 people died as a result of overdeaths related to opioid abuse. That is the equivalent of a plane going down every single day. Many of these involved prescription opioids, meaning that it's due to an inappropriate reliance by both patient and healthcare provider to try to fix a problem, when all it's really doing is masking a problem. Now, I understand you have to treat the pain and mask it in the short term, but I think of it as like a fire alarm. If you're fixing the fire alarm, it's okay to turn off the power. But if you just cut it because the sound is annoying, you're gonna probably have other problems in the future. Let's change our mind thought. Let's flip things around. What happens if the patient goes to the office and says, instead of saying, I have pain, they say, I'm dealing with pain. That simple substitution of words puts the patient in a position of power. They approach their healthcare provider and they simply say, I have this problem, I don't know how to fix it, can you help me? Okay. Pain is something that can be managed. I manage it every single day. I participate in something called Ironman. And for those of you who aren't familiar with what Ironman is, it is a triathlon. We first swim 2.4 miles. We then run 112 miles. And just because we are so special, we then run a marathon. Okay? Why do I do it? It's the only sport where it is a learned skill to be able to pee on yourself mid-stride. Now, when you're exercising at a high intensity for longer than most people work in the day, you are bound to undergo some discomfort. You're bound to have some signal as you exhaust your glycogen stores. But you'll notice the words that I'm using. I'm not using pain. Pain is something that we shy away from, where signal is something inherent to the sport. If you were truly racing to your utmost potential, you have to embrace it. You have to embrace that it's temporary and that it will be over. You simply manage it to the best of your abilities during that time. Now, this is in the middle of a race, but that concept can be applied to your daily life. If I notice that I have tension in my hip, the first approach is to try to roll it out or stretch it out and see if that takes care of it. But if it's stubborn, I have to reflect and ask myself, is it due to a biomechanical problem? Maybe I have a tight muscle elsewhere that I'm not aware of, and this is the compensation. If I'm particularly sore, maybe I'm eating in a way that's raising my body's systemic inflammation. At the end of each season, if I notice I've had a string of injuries, I try to put together a plan to eliminate any perceived biomechanical deficiencies so that that doesn't happen in the future. We can all wrap our mind around the concept of brushing our teeth, but what about TLC for our bodies? So, I ask each of you, the next time that you have pain, stop and process it. Decide if it's something that you want to deal with. Decide if it's something that you don't want to live with anymore. Come up with a plan to try to take care of it yourself. If you don't know what to do, use your resources. Visit your healthcare providers. But if they don't know what to do, that's not where the search ends. You have so many options out there available to you. All you have to do is look. Thank you.